A stroke is a loss of blood supply to the brain, and if it's not treated immediately, it can cause permanent brain damage or even death. Ischemic strokes happen due to blockage of an artery. This can be embolic, caused by a clot that's dislodged from an artery upstream, or thrombotic, caused by the buildup of a plaque in a cerebral artery. A hemorrhagic stroke is due to bleeding in the brain. This could be due to an aneurysm that burst or an artery that got torn or damaged. When we have strokes in the cerebral arteries, the anterior, middle, or posterior, it's really important to be able to identify the pattern of blood flow. So this is kind of showing you these patterns. This is looking at the external surface or the outside surface of the brain, and this is looking at the internal surface of the brain. The middle cerebral artery, which is in red, supplies the largest area of the cerebrum. The lateral frontal and the lateral temporal, and the parietal lobes are all supplied by the middle cerebral artery. Our anterior cerebral artery, and this is in yellow, supplies the medial aspect of the cerebrum. So strokes in this artery or its branches can affect motor, sensory, and limbic systems. And then our posterior cerebral arteries is supplying the occiput and the inferior aspect of the temporal lobes. And strokes in this artery can, or its branches, could cause damage to our visual centers and can affect the limbic system. The basal artery supplies our brainstem and cerebellum, and it gives rise to the posterior cerebral artery. So, if we had a stroke in a branch of the basilar artery that serves the brainstem, it really would affect homeostasis and underlying function. Our cranial nerve function can also be affected because our cranial nerves come off of our brainstem. And because there's so many white fiber tracts that run through the brainstem, and then communicate with the spinal cord, that communication with the spinal cord and peripheral nervous system could also be significantly disrupted.